clinical side, I will be teaching how to perform wound care and wound irrigation. I will start by checking the patient's medical chart and nursing care plan for any prescribed wound care. Then I will gather my materials, perform hand hygiene, put on PPE, all of which I have already done. Then I will walk into the room, identify the patient, ask the patient if they want any non-pharmacologic pain-reducing interventions or analgesic medication. If they say yes to medication, I will give them the appropriate time frame for the drugs to take effect, which is usually 30 minutes. Then I would come back after 30 minutes. I would usually tell them that it takes longer, but it's 30 minutes, come back, and then I will close the curtains, close the door, or I may choose to leave it open so the nurse knows that I'm in here, or I know if somebody's trying to come in. And then I would explain the procedure to the patient and tell them why it has been done. After doing so, I will grab a bag or waste receptacle and put it in a needed location. In this case, it would be probably next to the bedside table, but for the purpose of this video, I won't be throwing anything away because I will be reusing some of this equipment. So after doing so, I would assemble my materials. In this case, I have assembled my saline cotton tips and alcohol pads. And then I will go to bedside table, put it at waist level or elbow level. In this case, it is at waist level. And I will position the patient in a comfortable position, making sure that the wound is easy to access for me, to assess for me, and that when I pour saline over it, it will go from top to bottom, or cleanest to dirtiest. Then I would also make sure to cover any exposed areas on the patient that are not the wound to make the patient more comfortable with a bat blanket. And I will put a waterproof pad under the wound to protect the bat. In this case, we'll keep the wound like this because we don't have anything to hold it up. And then I will begin by tape removal, but before doing that, we want to check for positions of drains, tubes, or adjuncts. In this case, this patient does not have any. So I will begin, grab alcohol pad and remove adhesive around the tape. Then dispose of that. Then I will start at the corners and pull the tape in the direction of hair growth. Then I will use the push and pull method with the alcohol pad and push and pull, removing the adhesive from the tape, the corners. Then after doing so, I will do the center of the tape. I want to make sure to do this carefully to prevent any medical adhesive related skin injuries. And also, if I'm having a lot of resistance, I may use adhesive remover. Okay, so then I will dispose of this. So then it is time to remove the sole dressing. So to remove the sole dressing, I would pull, and if I'm having any resistance, I will grab saline and pour it all over the wound to loosen it up. So after I take it out, I will assess it for color, odor, type, and amount. In this case, the color is red, no odor. Type seems to be blood, and amount very minimal. So then I would dispose of that. After doing so, I would assess the wound for the appearance. The sinus tract stage appears to be 3 to 4. Then presence of vascular, there is no presence of vascular undermining. I see undermining at 12 o'clock. Tunneling, I see tunneling at 6 o'clock. Epithelialization, necrosis, I don't see any necrosis. Discharge or drainage, I don't see any. And granulation tissue, I see some granulation tissue, meaning that the wound is healing. And after doing so, I will check the skin around the wound, and I will measure the wound. In this case, that's what the cotton tips are for. So I will measure the wound at the deepest end to the outer end. I will use this to measure it. Appears to be 2 centimeters. Then I will do undermine. To be 2.5, and tunnel, which is 3 centimeters. So after doing so, I would dispose of that. Then I would chuck that, and I will remove my gloves. Okay. Then after removing that, I will perform hand hygiene. Then, for this next procedure, I will begin to be sterile. I will begin by starting my sterile field, making sure to never turn my back on it. I will grab from the corners. Making sure to let it drop. Doing so, we'll discuss this. Then I would assemble my wound cleaning and wound irrigation supplies. So we'll get a sterile basin, a sterile container containing gauze, and abdominal pad. So I will put this here. I would open the sterile basin and drop the syringe onto the sterile field. I would open this container and drop the gauze in there. Then I will keep the container open here. And then I will pour warm, sterile saline into the container. After doing so, I will begin put on my sterile gloves. So I will begin to put on the sterile gloves. Okay, after putting on my sterile gloves, I will begin to clean the wound. So now, the first thing I would do is I will put the sterile basin under the wound using my non-dumping hand, so it is no longer sterile. Then I would grab my syringe with my dominant hand using the sterile container with solution. I will fill it up with solution. Then I will grab with my non-dominant hand, I will push the sterile basin up against the patient's skin, creating a seal. Then I will stream the solution into the wound and making sure the tip of the syringe is 1 inch above the upper edge of the wound. And I will flush all around the wound until the solution comes out clear, smooth and even. Then I would stop the solution. We'll put away the syringe, and I will begin to dry with a gauze sponge. I will begin to dry the skin around the wound. After doing so, I will just dispose of that. Then I will begin to I would put the sterile gauze into the sterile container containing the solution to let them wet. After doing so, I will put on a screen protective barrier to around the healthy skin, where the tape would go to prevent the skin from touching drains or anything. Then I will grab my wet sterile gauze. But before doing that, I would make sure if the patient had any prescribed topical medication, foams or gels or gauze, I would apply it and make sure that it is confined and does not impact surrounding skin. So then I will grab the sterile gauze and I would insert it to the wound. I may choose to use cotton tip applicators to insert it. After doing this, making sure there's 1 inch in all air around all areas of the wound. Then I will dispose of that. Then I would put the abdominal or surgical pad, put it over the wound, and making sure that the blue line or moisture barrier is pointing towards me, not towards the patient. Then after I have done all that, I would dispose of my gloves. I would also make sure that the tape has been put on around the wound. I would remove my gloves. Then I'll perform hand hygiene. I will label the wound with date and time and initials. Then I would gather all my materials, remove all of them, put them back, and after doing so, I would put the bed back all the way in its lowest position, put side rails up, put the patient back in a comfortable position, and I would make sure to check on the wound dressing every shift, or more frequently if it easily becomes saturated or if it's complex. That is all.